Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. You can make use of it for convenience of the study. Meantime, as you know, we have been discussing about the growth and development in the children, and we are discussing an approach to a child with a developmental delay. In the last two classes, we have seen the basics of development, different types of developmental delays, and developmental milestones, etc. Now, once you identify that the particular child has got developmental delay, then how you have to proceed? Now, basically, there are different methods in approach of a developmental delay. Now, we have got three types of approach. Number one is developmental surveillance, number two is developmental screening, and number three is developmental assessment. Now, all the three are different now. Usually we follow any one of the method whenever the child has got suspicion of a delay in the development. What do you mean by developmental surveillance? Now, developmental surveillance is a continuous process. Okay, just like any surveillance, it's a continuous process. So similarly, developmental surveillance is continuous process. What is the meaning of it? That means, suppose if the child is born with some risk factors, for example, child had the history of birth asphyxia, child had the history of meconium aspiration syndrome, child had the history of some intrauterine infections, child had the history of some trauma, periventricular hemorrhage, intraventricular hemorrhage, etc., or any other untoward event at the time of the birth, then we have got a strong suspicion that in future, or even the child with a preterm, etc. So we have got a strong suspicion that in future child may have some developmental delay. So such babies should be identified and they should be kept under developmental surveillance. The meaning is continuously we have to observe this child. This baby has to be observed continuously, round the clock, round the year, round the day. Every week, maybe if possible, or every 15 days, child has to be reviewed, and the child should be checked for the developmental delay as per the chronological age. So this is just like a CCTV camera. In the CCTV camera, it is always working, isn't it? So it is catching everything. Similarly, in such babies with the high risk history, high risk factors are there. Round the clock, you have to observe each and every activity of that baby, and you have to correlate with the developmental milestones. So this is, and at one point of time, you may come to know that yes, this particular milestone is not achieved properly. Then you give some the spare period, and that is a range period is there. So then also it is not developed. Then you go for the suspicion and start the early intervention. So this is called as developmental surveillance. Second one is developmental screening. What is developmental screening? So in the developmental screening, so we are not doing it around the clock. Okay, around the clock, around the year, we are not doing it. So any one day, all the babies will be called. Suppose in a particular center is there, so you're calling all the babies in one particular decided day, and irrespective of normal and abnormal babies, whatever the babies delivered in that particular center, they are all called in one particular day, and then they will be examined. It may be a normal baby, it may be abnormal baby or sick baby. Everybody will be examined, and there is no any risk factor consideration. So you are not calling them as per the risk factors. You are calling everybody, and then you examine. Then if you find some babies are lagging behind as per that particular chronological age, so then you identify it and then you go for the treatment. So this is called developmental screening. This is somewhat very equal to a policeman who is checking every drunken driver on every Saturday. Okay, on every Saturday, usually Saturday, then next day is Sunday. Therefore, there is every suspicion that so driver may drunk. So they are irrespective of drunken and non-drunken drivers. Everybody they are checking daily, not daily, on every Saturday. So they will put that meter instrument in front of and ask them to breathe. So that whether they are consumed the alcohol or not, isn't it? We know that. So just like only one particular day we are doing it, not every day. Policeman is doing, only on Saturday he is doing. Similarly here also developmental screening will be done on a particular day. Okay, it may be once in monthly, or it may be every 6 monthly, 3 monthly. That's a different issue that you decide. So that is what is developmental screening. Another is developmental assessment. Another is developmental assessment. What do you mean by this? So once you found that the baby is lagging, suppose by the above two methods or some other methods, you found that the baby is lagging behind in terms of developmental milestones, then you have to decide the treatment. Okay, you have to decide the treatment, what has to be done. Is it one domain problem, two domain problem, three domain problem? Okay, it is a global problem. So then accordingly you have to set the treatment and management. Okay, so then you have to adopt the multidisciplinary approach. So multidisciplinary approach, and then you have to assess that baby. Then you have to assess how much improvement is there, whether this treatment is getting success or not. So all these things has to be assessed, and accordingly you have to change the management techniques, and you have to include multidisciplinary treatment schedule. You may need a surgeon, you may need a orthopedician, you may need a social worker, you may need a pediatrician, you may need a general physician, like that, a occupationalist, speech specialist, etc. So like this is called as developmental assessment. So usually in case of developmental delay, we follow these three methods: developmental surveillance, developmental screening, and developmental assessment. Now one more important thing that we should know is whenever you are going with the developmental delay, always go with the corrected gestational age. That is important. Now this is especially for the preterm babies. Okay, always don't go with the birthday of the baby. Okay, so birthday of the baby is only for the birth date or birthday celebration, and as well as for school admission. But as far as developmental assessment concerned, it is the developmental age which is important, not the birth date which is important. So what is the meaning of it? For example, if you take a preterm baby instead of 38 weeks, it is delivered in 35. So you are supposed to say that 3 months earlier it is delivered. Suppose you take a case. So 3 months earlier it is delivered. The date of the delivery is considered as the birth date, but actually developmentally, gestationally, it is 3 weeks immature. So for the development, we take that after 3 months. That means if the baby is delivered or today, then today may be the birth date of that baby. But developmental assessment, for the developmental assessment, 3 months afterwards, so the first day starts. After 3 months, the first day starts. Okay, so this is very important. Okay, for example, a preterm child, if the gestational period which is important, not the birth date. So till 2 years of the age, always go with the EDD. So for how many years you have to follow this method? Baby up to 2 years. Okay, it is not the chronological age which is important, it is the developmental age which is which is very important, up to 2 years of the life for the assessment of the gestation. That means baby should achieve the developmental milestones of 2 years by the maximum 2.3 months if the preterm delivery is of 3 months preterm delivery. I hope you got it. So therefore always ask the mother about the EDD. Okay, expected date of delivery, so that's very important, and then calculate accordingly. Okay, just to give the example here, suppose if the date of birth of the baby is 21/3/2020 and the EDD is about 21/05/2020. Okay, so then assessment will start from 21/5/2020, not from 21/3/2020. I hope now it is very clear. Okay, now one more important thing that we should know, that there is a range for every milestone to attain. It is not a hard and fast rule that by 6 months baby has to roll over, or by 3 months baby has to develop social smile. So there's a range. It may be at 2 months itself, or it may be at 4 months itself. Okay, maybe. So that range is there. Every specific milestone has got the range during the growth of the normal children. For example, standing the support is at 8 months, but the range is 8 to 12 months. Okay, so before proceeding with the developmental assessment, make sure that baby can hear and see. This is one more important thing. What is that? Development, before doing any development, first 2 things you have to ensure: whether this baby बच्चा अच्छे से देख पा रहा है, अच्छे से सुन पा रहा है, because depending upon this, all the developmental milestones are get affected. If the baby is not able to see, baby is not able to hear, and so many developmental milestones will not develop as for the age. as for the age. So therefore, especially for example, baby has got simple tongue tie and baby is not able to talk properly. No, definitely it will go into effects with the language milestones. Okay, it may be delayed. Or if the baby is not able to hear, again the language milestones will totally get affected. So therefore, these two things will be made clear that yeah, बच्चा अच्छे से देख पा रहा है, अच्छे से सुन पा रहा है. So these two questions or these 2 points you have to make clear before initiating any developmental assessment. So developmental assessment or the examination should be done in a non-threatening manner. It should be done in a non-threatening manner in a mother's lap, and baby should not be hungry or sleepy for the examination in the routine way. So what I mean to say, this is very important. कभी भी आप डेवलपमेंटल असेसमेंट करेंगे सो वो एक नॉन थ्रेटनिंग मैनर में रहना चाहिए. इट इज़ बेटर टू कीप द बेबी ऑलवेज इन द मदर्स लैप. इफ द बेबी इज मोर हंग्री, चाइल्ड इज इरिटेबल, so it will do some extra movement, so it may not respond for your commands, it is always crying. Okay, it looks sometimes hyperactive also, so this will change your developmental assessment. So you should not do such things when the baby is hungry. And similarly sleepy, a sleepy baby again may not respond. Okay, baby in a sleeping mood and he is not bothered about your examination and all, so he is always sleeping, so your developmental milestones may give wrong results. So routinely जब बच्चा खेल रहा है, खेलता खुलता कर, that time you have to do the developmental assessment. Okay, so these are some of the important prerequisites. Now usually we say that 10th month is considered as the right time for the assessment. 10th month of the baby is considered as the right time for the assessment because almost all the developmental milestones they reach a particular stage. Okay, explore. For example, by the end of the 10th month usually the mobility and exploration will start. Cognition and the fine motor development also begins, and the communication and language skills also develop by this age. So एक right age है, this is considered the right age to do the routine, that means to have the developmental screening. In the meantime, social and emotional development also begins. Child is afraid of angers, and child has got a favorite toys and also start waving bye etc. So like this everything will start by the age of the 10th month. Usually for a normal baby, ठीक है, जो normal baby है, so usually we will consider 10th month is considered as a best age for the complete developmental essay. इसका पहले वी हैव टू डू द डेवलपमेंटल से बिफोर दिस ऑल्सो, बट कंप्लीट डेवलपमेंटल एक स्क्रीनिंग जो है इट इज़ मेड पॉसिबल इन द 10th month because almost all these skills will going to develop at that particular point of time. So rest of the things that we will see in the next class. Thank you very much.